Welcome back. We're now going to focus on the other larger question that we have about how to deal with coronavirus when it begins to spread within the local areas and local communities. Now, the government may say that we are not in the stage of community transmission right now, but we have identified many hotspots where entire areas have now been sealed and have had to be shut down. I'm just going to take you some of these examples before we go across to our experts to really have a conversation about this. Take, for example, Dilshad Garden in the national capital in Delhi. 6 positive cases have been linked to one infected woman. Hundreds of patients of the doctor who attended her are now at risk because of that. In Nizamuddin, the case that we just spoke about for about an hour and discussed it in detail, 24 positive cases so far. 1,000 people have been evacuated, 333 have been hospitalized, and 700 have been quarantined. There is a belief and understanding that perhaps more will need to be evacuated from there and quarantined. Worli Kolivada in Mumbai. 8 local residents tested positive. The area has been declared a contaminated zone. Yesterday, you had officials there who were spraying all over the area, trying to sanitize the whole place in a complete lockdown that place after 8 locals tested positive. This is the fishermen's colony in Worli in Mumbai. Similarly, in Bimbisar Nagar, which is in the suburban Mumbai, in an area called Goregaon, a student who had returned from England tested positive. His brother got infected, his parents got infected, and household have now been quarantined. In all, about 8 buildings in this area have actually now been sealed. In Prabhadevi in Mumbai, again, in central Mumbai, 12 fresh cases have emerged from one chawl. Now, chawl are these crowded clusters where people live in really small little quarters in Mumbai, and it's an extremely crowded area, which is where the threat of infection spreading faster is the largest. 12 fresh cases from a chawl after a patient died. Deceased patient ran a mess that catered to a business center. The lady here, in fact, ran a food mess, and she catered to the commercial district of Parel, where now the concerns largely are about how many people could have been exposed and infected. In Kerala, further down south, 78 positive cases in Kasaragod as of March 27. 25 of the patients had travelled to Dubai. Then there were more who came in contact with them. The idea just to is tell you that now we have different hotspots across our country, where areas, localities, and buildings have been quarantined and isolated. But how do we tackle this stage now? What's the way going forward? That's the big question that I will be asking our panelists. Let's say good evening to Dr. Preeti Kumar, Vice President for Public Health System Support, PHFI as it is known as. Dr. Nerjis Mistry, Director of Foundation for Medical Research, joins us from Mumbai. Dr. Om Srivastava, Director for Infectious Diseases at Jaslok Hospital and Research Center, again joining us from Mumbai. And Dr. Thiagarajan Sundaraman, he's the Global Coordinator of People's Health Movement and former Executive Director for National Health Systems, also joining us this evening. Dr. Srivastava, let's begin with you. Mumbai now has lots of these areas that are being identified as hot spots. Are we prepared to tackle such a scenario, and how do we go forward? How do we deal with it?
Well, see, are we prepared? That's a question, in terms of preparation, you will know only after the situation is upon you. Now that the situation is upon us, this is the time to find out our resources, especially in regards to the public health system, which is, very robust, at least in the state of Maharashtra and city of Mumbai. So this is the time that we are going to be finding out how much of our resources are there that we can use, what resources can be expanded. Of course, there's always going to be some elasticity in the resources, but this is the time to find out whether the number of testing that is required, are you going to be able to meet that? When you do a test, will you be able to get the test results in time enough to take the next step forward? And so in regards to the kind of numbers that we are now beginning to see in Mumbai and Maharashtra, this will be the time in the next about 7 to 10 days time. We will know exactly. Certainly there is a lot of scope to expand the workforce, the man force, the people who are going to be taking part in the isolation, diagnostics, admission of such patients. But this is the time. We will know exactly where we stand in the next 7 to 10 days' time.
No, but so how do we go about ensuring that people in that area know and everybody responds and doesn't wait for the authorities to get in touch with them? Dr. Misri, if you couldn't come in on that, should there be wider, announcements or a large-scale testing that takes place in that area? So far, we've been very, very conservative even with our testing.
That is true. I think, first of all, I think people should be well informed about what the risks are through repeated sort of announcements. And also, I think that there needs to be some proactive steps taken to actually protect the population, which is highest at risk. And we have a reasonably good idea what the risk factors are. The overcrowding in Mumbai, about 65 to 70,000 people per square kilometer. But what is important to note is that many of the people who live in these vulnerable areas are actually service people. They go to the hospital sometimes on a daily basis, do menial jobs there, and come back and live in the same locality. So I think it's very important to protect people who live in these slums who are also giving essential services to the city. I think that's quite important. And I fully agree with the speaker before me who said about for the testing out the testing facilities. We are only at the moment testing symptomatics. We actually need to extend our testing system to be able to sort of do a surveillance on asymptomatic people also, because the data around the world shows that a lot of the asymptomatics contribute a lot to the infectious pool.
Okay, I take your point. Let me take the first aspect of it and take it across to Dr. Preeti Kumar. Dr. Kumar, how do we ensure that people in that area know without triggering panic? Between taking precautions and spreading awareness, but not creating a panic-like situation where everybody then starts running to the hospital. You have these examples now coming in from various parts of the country where such hotspots are being revealed. What should be the way forward?
So with the multiple hotspots that have emerged, so they are essentially where the cases are clustering. And it does speak to the ongoing surveillance that we have been able to identify our index cases in these clusters and quickly try to, make sure that we do very intensive case contact tracing and essentially step up the processes that have already been going on. So I think it's essentially to do everything that will allow us to break the transmission, and it's a very concerted effort, and it has to be on both sides because at the end of the day, whatever surveillance that you do is from the system side, and we all know that the system has a lot of limitations. But even from the community, and I would like to iterate here, with all the challenges, I think communication at the end of the day becomes one of the most important tools in public health. So if we have this, community preparedness and say, well, it is important to come forward if you have any symptom or you've been in touch with anybody, that is the only way we can make sure that we can at least do a geographical segregation of these clusters and allow to break the transmission. Yeah.
Okay, and are we prepared? Is there, to do such kind of a thing, Dr. Thiagarajan? So far the kind of contract tracing that we've seen, the government does tell us that once they have identified a patient, they do, send in a special team. One entire team goes who then starts to do contact tracing. But are we equipped to handle it at a larger scale? I'm going to take a case in point of what happened in Nizamuddin, where 3,000 people gathered. And then that event got over, the markaz got over, and they all went home or traveled to different parts of the country. And now we are staring at a situation where not just in Nizamuddin have 1,000 people been evacuated and quarantined, but from Srinagar to Tamil Nadu and Mizoram, the infection is, has spread, and there are people who are corona infected still there living in various societies.
So I think first point you should understand is that Nizamuddin situation was not of their making. They were already there for a conference, and the curfew was announced very suddenly. So there was no way in which they could get back. And if Nizamuddin caused so much of a spread, imagine what those mass migration that we saw in those scenes after the lockdown. What is the extent of spread that would have caused? It would have been far more worse, far less protected, far higher degrees of crowding. So I think we must get away from this myth of our own making that we are in this community transmission is some distant and distinct stage that will occur. All this stage 2, stage 3 is so much of our own narrative building. In WHO, there is a phase 2 and phase 3, and phase 3 is just a stage of amplification. We were inevitably going to be there. It's not as if reaching stage phase 3 means we have reached a point of no return and it's a terrible place to be, or that phase 2 is we are safe and we are triumphant and we are doing very well. It's just a part of a curve of an epidemic that is exponentially growing. One of the key things that we need to do now, having reached this stage, is to test, identify, isolate repeatedly. Self-isolation is a problem. If you look at that chawl over there, you were showing those visuals. What is the possibility of when people are living on top of each other, 10 to a room, 6 to a room, to have self-isolation? In such situations, you need to recruit hostels, hotels, community spaces, stadiums, where you can have some degree of isolation of those who test positive. And, though I would like to agree with Nargis, this asymptomatic testing is a dream for us right now. Even symptomatic testing is just not happening. Only severe cases are being tested. You can't test mild and moderate thing, as this evening I saw an announcement today. So if people get positive, these positive cases are walking around in those chawls because you have no way of identifying and removing and isolating them. So I think this failure to build in facilities for isolating those who test COVID-19 positive, but who are mild and moderate, is going to be a crippling factor for us when we go ahead. Again, when people come for testing in large crowded hospitals, there needs to be a separate stream, there needs to be separation. Otherwise, the hospital itself will become a site of spread. So I think we have a lot to do. We have 1 or 2 weeks with this lockdown. But we need to do a lot more.
So, in fact, right. Let me begin with you with my next question, and then I'll go to our other panelists. What should be the first step? Some of the state governments, apart from roping in private hospitals, have begun to look at hotels as quarantine and isolation facilities. Some of the companies have now started to manufacture ventilators at a large scale. We are taking few steps, but what should be priority number 1 and 2 for individual states to prepare us for what is now inevitable?
So, is the question to me?
Dr. Thiagarajan, the question to you.
Yeah, I think there are 6 or 7 key steps. One, of course, is ramping up testing. Every person who is symptomatic and asymptomatic contacts of a COVID-19 positive should be tested. The second is isolation facilities who are so tested. The third is to actually create some centers, and that's why people go for COVID-19 hospitals, dedicated hospitals or floors of hospitals where you can be isolated, where ventilators can be brought in, a number of ventilators, oxygen, because this is not just any ordinary ventilation. It's a very sophisticated type of ventilation that these patients need. Even if you have the equipment, the skills cannot be built overnight, and you will need to concentrate them so that under supervision you can take care of them. Then health safety, protective equipment in a much larger scale than we have needs to be brought in a very urgent way, manufactured, got in place. I think that's another major agency. Even patient transport systems and ambulance systems that are specifically dedicated for moving people for testing or home testing, and then to isolation, and then to intensive care, that also is a requirement. Human resource is going to be an important criteria. Supply chain management, because you have huge amounts of commodities moving is. So I think we have a long way to go. And even in testing, even as of today, part of the reason why we are testing so low and limiting testing to only very severe cases or contacts is because we don't have enough test kits. Reagents are running out of supply. We used to be dependent on imports, but no country can, US can no longer export to us because their needs have become very high. So we have to ramp up indigenous production. And only last week have we sanctioned companies to go into production, and they will, even at their best, they will take 2 to 3 weeks to start production and ramp it up to the scales we need. So we are facing an immense challenge. What we should have done in some of these things a few years back, with this 15,000 crores we got, was the precise sum that we were recommending as an increase in the budget 4 years back. It's for the last 4 years, if they had given this 15,000 crores extra, we would have prepared our district hospitals, our indigenous manufacturing capacities to meet this epidemic. We are so underinvested and underprepared that we need a lot of catching up to do. Fortunately, there is a political will, but it should take its attention away from the lockdown, which will only take you so far, and focus on these simple words: isolate, test, treat, and trace. Just these things. The WHO DG got it right there. Just repeatedly isolate those who are COVID-19 positive, test to make sure that you have got it, then make sure you treat them and trace all their contacts and go through this cycle again. You can't do it with a lockdown. Lockdown in a situation where there is very, very poor social is going to be very difficult.
You say you can't do it in a lockdown situation, but Dr. Mistry, unless we know what are the focus areas and hotspots where we need to focus, isn't it better that everybody just stays where they are, away from the rest of the world, in a quarantine kind of a situation? And I will go back to the Nizamuddin example. There are now reports coming in of 20 and 30 cases from different states. People who went and attended this event got exposed to the infection, perhaps which came from abroad somewhere. And now different states will have to battle with it. And these people would have come back a week ago. They have stayed in those localities, in that neighboring zone, interacted with people around them, risking further, family members and friends and neighbors to this infection. How do we step up from here on? Don't we need to be in a lockdown situation for that?
Certainly, I think you do need a lockdown situation, but as has been warned by the WHO, the lockdown itself is not going to be enough. You need to do far more steps, which have been enunciated very well with by Dr. Sundar, just in the last blurb that he gave. But what I would like to go a little further is to say that these quarantine facilities, these so-called isolation facilities, need to be slightly geared up. I think one of the things that's been forgotten is that the COVID infection is an airborne droplet infection also. So I think quarantine facilities, the testing facilities, which Sundar alluded to just a while ago, need to be ramped up for airborne infection control. There is technology available, which for some puzzling reason, there has been a lot of reticence in applying that technology. And I'm referring to the germicidal ultraviolet light technology, which is actually shown in other conditions, airborne infections, to be 75 to 85% efficient. So I think these sort of technologies need to be tried. The infrastructure is available. It's available in India, but it needs to be applied and applied quickly to be able to prevent this cross-infection from happening in our facilities, wheresoever they may be. They may be quarantined, they may be just isolation, but I don't think in slums and in those vulnerable areas, you can rely completely on social distancing or lockdown. And you do need to have additional measures of very intensive testing. As he said, there's still a long, long road ahead of us.
Yes, okay. You raised a very valid point. Let me take it to Dr. Om Srivastav. Dr. Srivastav, crowded clusters, chawls, slums, where once the infection reaches, social distancing is pretty much impossible there. Then what should be the plan of action for authorities?
Well, what is your choice realistically, except for getting these clusters to declutter? That means you will need to get these people going into places, whether it is a hostel or a hotel or a college that you have vacated, getting people to go to these facilities and be observed there for a period of time where you know that, okay, they are now safe. Again, like I keep saying, you need to be prepared for the situation with the kind of problem that you are going to face. The first thing is, do you have the infrastructure? If that is the case, that you do have the infrastructure, you need to implement it. You need to get on with the process of getting. So you've taken the names of a couple of slums. You will need to declutter them immediately. You'll need to do that right away. And that means lockdown is one thing, but decluttering is quite another. You will need such people to move out of those places, go into a facility where they can be observed and tested. Once their swab is negative, then only and then they come back to living where they are and making sure they're not passing on the infection to other people. So it is something that the direction forward is quite clear. The
I'm
only
sorry,
thing
I'm
is,
interrupting you here.
how soon can you
but
implement it? And that
let me come back to that point you made before. Yes, you say decluttering is the only solution right now, and then you test and then you see what happens. What we are seeing in some of these slums or crowded areas where more than 10 people have tested positive or are being tested right now and are showing the symptoms is that the authorities are sanitizing the place. They were using spray in the Worli Koliwada Fishermen's Colony today. In Goregaon, they've just locked down those buildings and those people are not allowed to go anywhere. You're saying that's not enough? Just sanitizing and quarantining is not enough? We need to move people out of there and take them to other locations, in which case, right now, the Maharashtra government should be identifying buildings, hotels or other official buildings that can be used to house these people.
Indeed, you'll have to. You'll have to, because look, the sanitation of a place, you're using a spray, but in locking down, you've not taken that person who is infected, that one person who is living in a building of, say, 40 flats or 50 flats. That one person needs to be away, because this is something that we have already established. The virus is not just by droplets, it is also by fomite, that is by a surface that has been touched by somebody who's infected. That surface is going to be a potential source of infection for anybody else who comes in that contact. So this is droplet, this is airborne, this is fomite. And so what you need to do is something simply by saying that we have quarantined or we are spraying this place. I'm not sure if that is going to be adequate to ensure, because the person who is infected in that particular cohort that you're saying of 10 people or 20 people, that person needs to be distanced and kept away and probably put into a place where he can be observed. So if you're going to do that, you're going to need to put such people into large, vast areas of non-medical facilities, because these patients are asymptomatic. They are not the kind of story where they need to be hospitalized or to be kept in a clinic or need to be assessed every day. If they have a trouble after the person becomes quarantined, yes, please assess, please reassess, and keep assessing again and again. But for the immediate steps, unless you are going to declutter, the concept of having a social distancing in a place like Dharavi or any of the slums that you have just named, I think it's going to be practically a little bit difficult.
Yes. Yes. Thank you so much. And I think that the authorities, that the state government and the medical expert here who are working closely with the government need to understand this and move quickly, and not just in Mumbai, but many other cities where such crowded areas, localities and neighborhoods exist. Dr. Preeti Kumar, shouldn't that be one of the things that we start looking at right away? We keep saying that we are not in the stage of community transmission, but if it does happen in a couple of weeks, are we really prepared with that kind of locations, quarantine and treatment centers, and even the infrastructure?
Absolutely. The way things are moving at the moment, there is a lot of emphasis on actually containment. And this is the time which deliberately even the government has brought to actually step up and scale up and ensure that we have at least some level of preparedness, because many of these cases willy-nilly are going to go to the next stage. They are going to get infected. They are going to come to the hospitals. So what I think is that there are two parallel systems. One is, you really have to have step up your infrastructure, your equipment, your human resources actually to gear up for the coming time, because the cases are going to transfer into infected cases. Some of them are going to go into a serious situation, and you will need to step it up. Coming back to the need for stepping up, one of the things which is extremely critical for us is also, as it is, we have a paucity of healthcare workers. We need to guard them. We definitely, more than anything else, we also need to guard our health workers, because if they fall ill, Spain is reporting almost 18% of people who are infectious. We need, protective equipment for them. So if they are guarded, that is, so all your activities of contact tracing and isolation and quarantine and following up with them is only feasible if you have a workforce which is trained, which feels safe and is protected to carry out its activities.
Okay. Okay, all right. Dr. Misri, would you want to add to this in terms of the preparation that we are talking about individually in cities? What should the authorities be looking at next as we see more and more of these hotspots really spring up everywhere?
I think if you want to know how to go ahead in this situation, I think one of the most important things is to have data. And I keep on repeating that again. You cannot decide what to do next unless you have data. And data will only come with more testing, with also knowing our epidemic. Is what is the virus like, what is the mortality rates, because mortality rates are also very varying in different parts of the world. It goes anything from 0.2% to 15%, depending on your comorbidities and so on. And there are likely to be vulnerable comorbid people in these vulnerable areas also. And how do you actually give to them a comprehensive healthcare system that looks at all of this together? That's a big challenge. So I think in terms of where do you isolate these people? Where do you quarantine them? Protection of the health workers, as the last speaker said very nicely. I think all these are things that will have to be looked at very quickly and very competently. That's all I can say for the moment. But what we require more is more data on the epidemic, the more geospatial, how are these cases placed in that community? How far are they from each other? What is the geospatial distance between each of these two cases? Do you find an epidemiological link? Or if you don't, what is the interpretation of that? These sort of hardcore epidemiological questions need to be answered, and that competencies must be brought into the system very quickly.
Yes. I just want to point out some of the other examples that we have. And this is for people to also understand why this quarantine, isolation, social distancing, lockdown, whatever you call it, needs to be taken seriously until we are very sure of where we stand. And we don't know where our country stands right now. Even if I show you the way the numbers have increased, the corona curve as we are calling it, on February 7th, we had 3 cases. On March 4th, a month later, we had 6 cases. By March 15th, we had about 107 cases. And after that, on a daily basis, the numbers have just increased very, very quickly. So by March 20th, we had 236 cases. By March 25th, we had 606 cases. And just in the last 5-6 days now, on March 31st today, the government has told us we have 1,251 cases. This is not going to stop right here. The numbers are expected to increase further on, at least for the next couple of weeks, which is when perhaps we'll have a clearer picture of where this country stands and just what it is that we need right now. And in that scenario, Dr. Thiagarajan, would your advice then be to individual states to start identifying buildings And will we also then need volunteers? Do we have enough healthcare professionals to deal with such increase in cases?
We need volunteers and we need healthcare professionals. These perform different functions. Certain functions which are less healthcare demanding, like contact tracing, like public education, support to people in home quarantine, should be done by volunteers, leaving the healthcare professionals freer to concentrate upon clinical work, which will be mounting. I think this is an important difference. We do need to make sure that a lot of people who are waiting and pending for employment and all vacancies are filled up on an immediate basis. We don't need to go through complex processes of recruitment. We just need to do it immediately. But one important thing that we need to do is to destigmatize the disease. We are creating a type of fear and a type of victim blaming. If this level of hesitation is there, people will hide from declaring that they are ill. If they feel that the people around them will turn hostile to them or look down on them. And this happens over few hundred years of epidemic management. We know that if you stigmatize the disease, they don't come forward to get treated. So it's important that whatever we do in a very humane manner, not in a brutal manner. In fact, we must be able to take them along and see them. So even when Dr. Om Srivastav says decluttering, my concern is that look at the symptomatic cases, offer them help. They can't get well at that place. Take them aside, take them into confidence and do it. Otherwise, you won't be able to do it at all. And yes, we will need to also, if necessary, commandeer or persuade private hospitals to be completely placed under public authorities in many of the places to expand the capacity of the state to manage it, at least in this crisis. After the crisis is over, we can give it back. But we will need specialized COVID-19 management centers for every cluster of districts, or if a large district like Nashik, you may need a separate one just for Nashik. But in a smaller district, a group of districts. So you need isolation centers, which are sort of halfway homes where you have very little medical requirement, and which is different from quarantine. Isolation is for a sick person, for a COVID-19 positive person, but mild or moderate. Whereas quarantine is for a contact who does not have fever, who does not have symptoms. So you will need quarantine centers, you will need isolation centers, and you will need COVID-19 care hospitals, which can do severe care and critical care. And to build these up is a challenge. It's a challenge. But I think at some point when the Indian government puts its mind to it, they can. That way, this government can do it if it gets around to doing it and understands the priorities of what needs to be done. Too much of this victim blaming, sort of saying that people are irresponsible, will divert them from doing this. I think basically.
Okay, interesting that you make that point, because I was just going to ask this question. And I was going to take this to Dr. Preeti Kumar. Dr. Preeti Kumar, should there also be a tougher message that's sent to people? Maybe, set an example by punishing a few people for not taking the lockdown seriously, for hiding their travel history or possible exposure that they may have had by attending some event. Far too many of these cases are now emerging where people have consciously hidden the information.
Yeah, absolutely. I said at the start of my conversation that for public health, communication is really the most critical and valuable tool that we have. So while the community really needs to feel that they have trust in the system that is going to provide them services, and that trust should lead them then to actually abide by what is being asked of them. And that means that they should feel comfortable enough. They should be told, look, this is the whole destigmatizing process for this disease is extremely important at this stage, because we have seen it in other epidemics. stigma just drives it underground. And unfortunately, we do not have the time or the space to actually, dig out cases. Actually, our contact tracing has to be done on the basis that people come forward to us and say, I was in contact, please test me. And the people need to feel comfortable that this testing is being done to protect them and their families. So I think the whole communication environment is really needs to be stepped up. So, and this communication has to be at multiple levels. It's for the doctors. It's for the health workers, frontline health workers. We don't know at this stage, but frontline health workers, while they are being trained, they do themselves need to feel comfortable and feel protected and safe when they are in the community and providing the services. It has to be very contextualized. It has to be customized. An urban messaging is not the same as you would do in an urban slum or in a rural area. So I would again emphasize that having a comprehensive a strategy that sort of, communication messaging that goes right from the top down to the block and the village level is of most important, so that people just don't feel that there's any stigma attached to it and they're willing to come forward and to get tested. However, associated with this is not about health and healthcare systems at all. There are multiple other services, essential services that are attached to it. So our communication does not only exist to the community and the healthcare workers, it is to the broader audience, to our police, to the people who provide civil supplies. So, so there is what we have been saying is a comprehensive communication that allows people to feel comfortable, to stay in their home, to manage isolation, to stay quarantined, and to come forward if they feel that, yes, they have the symptom and to get tested.
All right, some of very key important points that have been raised by our panelists tonight, and I'm just going to summarize those as I thank our experts for joining us on this conversation. We need to ramp up. We need to ramp up our isolation facilities, our quarantine facilities, even our treatment centers. We need to ensure that there is no stigma attached to this, so that people actually come out and admit that they may have been exposed to this, that they may have been infected, and do not hide their travel history or exposure history in that sense. We need to do a lot more when it comes to crowded areas, apart from sanitizing those areas once multiple cases emerge. Just sanitizing or quarantining it will not help. It needs to be decluttered. It's a policy, it's a step that cities like Mumbai and Delhi and others where there are crowded clusters and neighborhoods need to look at. Otherwise, we will not be able to stop this infection from spreading. The minute it gets into a crowded cluster, it becomes very, very difficult for people in that area to really distance themselves from each other and live. That's not how they live. They don't have the space, which is why decluttering becomes extremely essential. And yes, perhaps a lot more testing is needed. It is time now to start getting out there and testing more people to see just what is the situation and the kind of extent of spread that we are looking at our country. Thank you so much to our experts for joining us. We're going to take a very short break. On the other side, we put the spotlight on the essential supplies. Where do we stand? What are the key hurdles still? How much of it has improved in the last few days? Quick check on that. Stay with us. Welcome back. On to the big focus now about the essential supply chain and just how is the situation there. It's been a week since Prime Minister Modi announced the lockdown and a complete shutdown of even economic activity. And then after that, a series of circulars have come updating on what can function and cannot function, what can be manufactured, what can be transported, and what cannot be transported still at all. We are now looking at a situation where more and more of goods movement is allowed. And so far, most of the big cities haven't really complained about any extreme shortage of supplies. But what do we need to do from here on to ensure that the supply chain doesn't get impacted? Now, if you remember, viewers, a few days ago, Mirana highlighted to you what was happening as far as the transport sector was concerned. There, we had the biggest issue. And if that doesn't get fixed, then the supply chain and this will get affected. And the issue was that the truck drivers were abandoning the trucks and running away because the authorities weren't allowing them to cross borders, inter-district borders, interstate borders. There was no food available, no water available on the highways because all the dhabas had been shut. They didn't have money on them, and because they were not being allowed to drive their trucks, they were simply abandoning these trucks and moving away. 60 lakh trucks, the last time we checked, had been abandoned on highways and big main roads in such a manner. Has the situation improved? Has it worsened? Is it still the same? Are still the highways, state highways, getting clogged with abandoned trucks? What needs to be done to ensure that the essential supplies reach your and my doorstep even in the coming weeks? That's the big question I'm going to ask our panelists this evening. Let's say good evening to Mr. R.S. Sodhi, the MD for Amul, who's joining us this evening, and Mr. Bal Malkit Singh, Chairman for the Core Committee and former President of AIMTC, which is the All India Motor Transport Congress. Mr. Singh was with us, in fact, a few days ago, giving us a lowdown on what the situation is on ground. Mr. Singh, let's start with you then. Has the situation changed? Have the trucks managed to get a move on? Are your drivers coming back to get these trucks out?
As sta-
Mr. Bal Malkit Singh, the question to you, if you can hear me.
Yeah, I can hear you right now. Just repeat it.
No, I want to understand from you what is the situation currently. The last time I spoke to you, you said 60 lakh trucks were still stranded on highways. The drivers were forced to abandon these trucks. What's the situation now?
First of all,
Yes, Mr. Singh, you can continue. I can hear you. Your TV will show you a bit of a lag, but if you can hear me, you can respond. We can hear you.
first of all, I would like to thank you to Mirror Now for highlighting our issue on the very second day of the lockdown, which we have highlighted that 60 lakh of vehicles are stranded all across the national and the state highway. And day before yesterday, that was on 29th, the Home Secretary has issued an advisory which states that the movement of the essential commodity as well as the non-essential commodity can be moved across the country. As on it had helped us for the stranded vehicle to reach its destination and the high value consignment which was lying idle and which was in very worrisome situation for the vehicle owner that the local goons may not take the benefit of the situation and may start looting this consignment. And I am happy to say that these consignment had reached to the safer hideouts. As I have stated you previously also, our drivers have abandoned the truck and they have moved to the native places, and some others have gone to the safer hideouts with the basic amenities of food and shelter. Now, how to continue the supply chain? It is a war-like situation, and we all have to work on a war footing. We are trying our level best to convince our driver, be the hero in this war, and let us collectively fought this war against the coronavirus. But still, there are a lot of challenges before us. The challenges before is that the transport companies are locked down, our offices are locked down, owners are locked down, staffs are locked down, our workshops are locked down, our godowns are locked down, dhabas, eateries all along the highways are closed down, are locked down. Now the major problem is that in this supply chain movement, lot of manpower is required, right from the manufacturing unit for the delivery to the wholesale market, then to the retailer, then to the household. Lot of documentation is required and lot of manpower is required. If we lift, if we have to, first of all, it has to be procured from the manufacturing routing or the farmer places, whether the labor is available there, whether that manufacturing unit is working or not working. Then our roles come in, the transporter roles come in, and the truckers role come in, driver roles come in. And there are a lot of challenges. And if the vehicle crossing from one state to the another state, covering thousands of kilometers and making the deliveries, what will the facility available to them en route? Whether the eateries, dhabas will be open for them, whether the workshop will be open for them, whether the tire puncture shop will be open for them. These are the basic requirement which we have been asking and sending the advisory to the center also, to the state government also. And being the federal system, all state government has the different rules and regulation. And as the cases are increasing from one state to the another state, now only just I have read that the Gujarat have given the permission for the movement of the essential and the non-essential commodities. Whereas on the other side, just on your channel only, CM Uddhav Thackeray was addressing his press conference and stated that all the border had been sealed and there will be no movement. In these circumstances, how we will be able to move our consignment from one state crossing 27 states all across the country? And as I already stated, our staff are unable to move to the loading point for the supervision to the unloading point for the supervision. Is the wholesale market is open? Is the labor is there for unloading of the vehicle? And then that material has to be shifted in the small vehicle, that is LCV, to the retailer. And retailer, it is being shifted to the distributor to the shops, where the benefit will be get to the household. These all challenges are before us, and we have to
Correct.
face these challenges, and I have the solution for that also. Logistic task force, as already advised by All India
Okay,
Motor
I will.
Transport Congress. Okay.
Yes, Mr. Singh, let me come back to you on that, on what needs to be done from here on. I also want to get in a word from Mr. Sodhi. Mr. Sodhi, after the lockdown was announced, Amul was one of those companies that came out and said that there is no concern as far as the supply is concerned. There is enough and more milk available. But increasingly now it looks like, Mr. Sodhi, that the problem is not the supply or the availability of the stock. The problem is getting it to people because of the transport issue.
Tanvi ji, I fully agree Shri Malkeet Singh ji, all the points or all the difficulties which he has pointed out what the transport industry is facing, and all are right. You see, if I tell you, I mean, besides the medical people and police and traffic, the one industry which is really doing a wonderful job and maintaining the supply chain, especially the food which you are getting in your home, it is because of the fully operational transport industry. If they would have been there, you would have been getting vegetable, you would have been getting milk, you would have been getting your atta, rice, everything. Now, coming to the problems, see, like in case of fresh, we got two types of product like milk or vegetables, which are transported locally within 100, 200 kilometers. We pack it and transport. There, we do not face much of the problem. Little bit is there, but all permissions are there, and we are able to manage it. Problems are coming the long distance transportation. And long distance travel, the first problem is no doubt Ministry of Home Affairs have given that all the trucks having essential products like food or the packaging material or the other sport material are allowed. But problem is when truck is moving with these loaded essential products, all are allowed. But same truck after unloading, when the empty truck is coming back to the warehouse or again to load it, those empty trucks are not allowed. You tell me, if you send it, if you don't get back the empty trucks, how you load it? Second problem is all the industry or all the warehouse of food industry essential products are allowed to open, but non-essential durables and others are not allowed. So half of the trucks are loaded lying outside the warehouse, outside the industry for the unloading. So those trucks not available for loading. Second is the labor problem. Right now in our warehouses, all our plants, only 25% labor is coming. So we have to manage all our warehouses all across India with 25 or 30% labor. So we are always in dilemma whether to first load trucks which are going into the market or we should unload which is the incoming. So there lot
Right.
of delay is happening. And the third basic problem is, like Malki Singh mentioned, thousands or lakhs of drivers have abandoned the truck. That is true. Basically, reason is, you see, these truckers, when after taking a round of 2,000 kilometers, then when they are going back in their village, in their colony, they are not allowed. I mean, they have been told that you have moved all around. So how can we be sure that you are not carrying corona? And fourth is the sports. No sport en road. I mean, where to eat? Where to get your tire punctured to repair? I mean, there are no facilities. I feel, although government is looking to all the difficulty, but we have to look into basically the difficulty, that how to ensure that empty trucks are moved and drivers are getting all the facilities. Without drivers, you can't do it. Without manpower for unloading, you can't manage it. And that is the need of ours.
Okay, no, and the point that you made, Mr. Sodhi, before I go back to Mr. Malkit Singh, about workers also, you're getting only 25%, a quarter of your workers turning up. That's also a very important problem. How do we solve that? Is it because they're not being issued passes, or because they don't have a mode of transport to get to work, or because they are scared that if they step out, they will be harassed and they may get exposed to infection?
You see, all this combined. Firstly, mainly the labor problem is coming in the bigger metro towns like Bombay, Delhi, or Calcutta, because there most of the migration labor working. In smaller places, labor we are able to manage from nearby places. Then even in Bombay or Delhi, if you are able to get manager, they reside very far. Earlier they used to come with the public transport or their own two-wheeler or something. But now those things are not allowed. And second, it is, I mean, wherever we approach the local authorities, passes are being issued. But for labor, it is very difficult to predict who is going to come, who is not going to come. And a little bit harassment was there earlier, but now those things have been settled down. But I feel gradually labor problems should sort out. We have started paying 30-40% more for the loading and unloading charges. Even for the transportation also, because of the very few trucks availability, transportation rates have increased by 25 to 50%, especially from the west and north to the south. Trucks are not, wherever trucks have to pass through Maharashtra, rates double. Because the biggest problem transporters which are facing is in Maharashtra.
Well, thank you for highlighting that point. I hope the government takes note of it. We will also follow up with the Maharashtra government. It's a very important issue that, trucks passing through Maharashtra, not just coming into our state for our supply stores and grocery stores, but even going via this state to other states, are in trouble. And this may not immediately reflect in our supply in the cities, but it will, viewers, which is why it's important for the government to understand this right now and take some more preemptive measures to fix the problem. Mr. Singh, you were saying you have a list of steps that we should look at as solution. What is it that the authorities need to do on priority to ensure that tomorrow I don't run out of essential supplies in my city?
We have the solutions. That is we are already advised to the Ministry of Road Transport Highway. Logistic task force should be formed at the earliest, and All India Motor Transport Congress, which is the apex body, which is representing 90 lakh people all across the country, with 3,500 state, district, taluka association affiliated to it. The requirement should be shared with us, and we can pursue our local associations to ply that essential commodities, essential, non-essential commodities, for transporting it within the state or for transporting it from one state to the another state. And as rightly said by Mr. Sodhi, that most vulnerable in this, always we say that the paramedical staff and the doctors are most vulnerable to this virus, but truck drivers who is running taking the consignment from one neck of the corner of the country to the another corner, he is most vulnerable to this virus. And as in your show only, I had also suggested last time that 50 lakh insurance covered should be provided to them and to the persons who are involved in the supply chain for delivering this material, and on where all the facilities should be done. And as a responsible citizen and as per the responsible association, we also should be very cautious that the virus should not be spread all across the country, especially the interior part of the country. And as earlier suggested by us, there should be a camp on the highways in which all the drivers who are coming should be checked whether they are having any symptoms. Then only they should be allowed to enter the border of the other state. And as stated by Mr. Sodi, that drivers are not allowed to come into their colony. I was reading some media report. Then when one of the driver who has this virus problem, entire village were blocked by the villagers for a movement of the trucks. This all steps has to be taken on the war footing.
Yes.
As I already stated, it is the war we are fighting, and the war has to be fought on the road also. Drivers,
Yes.
and that on the border also, that vehicle has to be sanitized. The driver has to be checked. If he is having problem, he should be immediately sent to the hospital for the medical treatment. So this will prevent the virus for spreading all across the country.
Uh,
Okay, my last question to Mr. Sodi. Mr. Sodi, the issues that both of you have highlighted here, if those issues don't get resolved in the coming days, will that be a concern? Will there then be a shortage of essentials, even milk, in some parts of the country?
First thing I'd like to answer, Shri Malki Singh ji, one thing is that some expert committee, already Government of India has formed a core committee for the supply chain problems, and very senior officer, IAS officer Shri Param Iyer is the head. And in fact, in the morning I spoke to him, and we have also apprised him suggestion. I request Mr. Malki Singh, you please address all your problem to him. I think Government of India is very sympathetically looking all these problems. It should reach to the right platform, and they will look into this. Second is, these problems had to be looked into this, because whatever now consumers are buying are stocks available in the pipeline. Whatever is purchased or consumed,
Correct.
that much is not being replenished. And maximum pipeline stocks are for 15 days, 20 days, or more than. So if you are consuming 100 and you are replenishing 50, so 50 is going to be deficit, and it is going to gradually come up. So I feel better we understand the real problem of transportation and try to sort it out.
Yes. Yes. Oh, yes, absolutely. And I think, we cannot emphasize on this enough. And thank you, both of you, for joining us and highlighting this issue, because if we don't get this right in the coming few days, then things could get tricky, and we don't want to look at that situation. So far, thankfully, we've not had a problem with our essential supplies, but that's also been, like our experts were pointing out, because there's been a pipeline. Your stores have had some amount of supply, then your local city godowns and warehouses would have had a supply, and there would be some which was on the way. Now, if the manufacturers are not able to make more products, make more of your daily goods that you need, because the workers are not turning up, or they're not able to send it across to their local warehouse or to another state warehouse because the drivers are not turning up, then it's going to be a problem. If the states don't allow these trucks to travel, then it's going to be a problem. If the states allow trucks with stock to go but harass the trucks that come empty and then start asking questions, those drivers are going to run away. If we don't treat these workers and drivers also like our corona warriors and take care of them and ensure that they have food and shelter, and they are not thrown out of their own villages, and if they do, they have a place to stay separately from the rest of the village. If we don't do all of this, then there will be a big issue with our essential supply chain. and India cannot afford to do that as we unite together in this lockdown period to take on coronavirus. So I hope that not just the Chief Minister of Maharashtra, but even the Transport Minister of our country is looking at this, and together everybody works at a situation to ensure that the transport issues get ironed out as soon as possible. Thank you so much for joining us on this conversation.